We always hear that honesty is the best policy, right? Well, let's be honest right here. Do you tell your doctor the truth?
Yeah, perhaps you're guilty of holding back a few nuggets of information every now and then. Well, you could be putting yourself and others in danger. This afternoon, we learn more about the risks.
I don't tell them, exactly all the sweets that I eat.
If it's something that I feel is of the norm and not a huge risk, then I would omit it.
What do you fib about when you go to the doctors? How much sweets you eat?
Yeah.
Fibbing is far from what endocrinologist Manira Siddiqui wants to hear in her office.
It can be very detrimental to your health.
Siddiqui treats diabetics. She has to know exactly how much sugar they eat so she can prescribe the right amount of insulin.
By adjusting your insulin based on blood sugars that are false, I could have done harm to this patient.
She's even had to fire a fibbing patient.
They were actually making up their blood sugar numbers, and the reason why they did it is they knew that I wouldn't give them samples if they would not have blood sugars when they came in to see me.
Psychologist Valeria Moore also deals with dishonesty a lot.
Sometimes there's outright, blatant lies.
The red flags go up when the eye contact goes away. Huffing, grunting, fidgeting, and re-asking a question are also signs of fiction.
Well, what do you mean by that? Oh, do you mean how much alcohol did I have yesterday? Or did you mean ever?
Moore says smoking, alcohol, and illicit drugs are what most of her patients lie about.
We're running the risk of them going through withdrawal in the hospital, experiencing DTs where they're at risk for seizure activity, perceptual disturbance. And if we don't know that, we can't treat it. And that puts the patient in a very, very dangerous position, as well as the other staff and other patients.
Dr. Moore says they lie because they're afraid of being judged. Dr. Siddiqui's patients may lie because they fear they could lose insurance coverage. A recent survey showed that 28% of patients admitted to lying, but in a Wall Street Journal report, doctors say the real number is 77%.
I do need people to be truthful. I need people to be honest. I need them to be compliant in order to help them.
There's always things that we want to hold and keep to ourselves.
But not at the doctor's office.
So what else should you be honest about when you're in the doctor's office? Well, according to Fitness Magazine, if your doctor asks what's new, tell them. Maybe you have work woes or your relationship is on the rocks. All of that stress can lead to health problems. Your doctor may be able to suggest a few stress busters to help.
Now, if you're taking supplements, and studies show more than 50% of us do, tell your doctor. Certain supplements can have adverse reactions with other medications, so it's important your doctor knows the truth about what you're taking.
And be honest about your intimacy. Your doctor needs to know if you've had unprotected intercourse or a sexually transmitted disease. Doctors say certain STDs, if left untreated, could even cause fertility problems. Now, experts say if you don't want to speak up about your intimacy, you should at least include that information on your medical history form.
Okay, so let's say your health calls for surgery. What if doctors tried to outbid each other to win you over as patient? WBOC's Aisha Khan stops by to tell us more about this new way of doing business.
And later we drop some silverware in hot water with the Speedy Plate Tarnish Remover. See how well it holds up as we put it to the test. But first, we just learned about opening up to our doctors. Maybe you don't like discussing female problems. Dr. Oz helps us weigh the pros and cons of a procedure that could help.
Hi, I'm Dr. Oz. Hysterectomy is the #2 surgery performed on women in the U.S. behind only C-sections. The procedure can be used to treat cancer, fibroids, endometriosis, and abnormal uterine bleeding. Women with strong risk factors sometimes have their ovaries removed concurrently. Afterwards, menopause-like symptoms are common.